They
let me
say,
try.
hey, I'm afraid to take testosterone because I heard it's bad for my heart.
Let me be, I pride myself, only evidence-based medical support. Everything I do has to be medically, but okay. A man, so testosterone, is it worse for the heart? We don't know. That's a question that, depending on what perspective, are you a 17-year-old man, a 20-year-old man, a 40-year-old man? Well, men have androgens, so that makes them men, and they have early heart disease. Men do have early heart disease. It's multifactorial.
I love that part about what you say. It's like, it's not one thing. It's like you talk about blood pressure, diet. Yeah.
People, this is why it's such a cerebral and a real scientific endeavor. What I do, this is like, you just don't make these generalizations. So the data, unfortunately, let's go into what I know you want to hear and people want to hear. Testosterone replacement. For years and years and years, there's data currently that shows its positive effect, that if you're hypogonadal, you have a shorter lifespan. If you're hypogonadal and you have existing coronary disease or CHF, you're going to die. Now, I can go into that because I'm a freak, and I can tell you all the studies. My friends are doctors over at Harvard and the guys at Baylor. Look, the truth is, you have to look at everything from a point where there's standard evidence-based guidelines, where it's N equals 1,000 versus N equals 1.
Yeah.
So you look at a man, if he's middle-aged men, I learned all this from these great doctors. This is just a cauldron of what I've learned from my colleagues, and I take from the pieces like people should. They work for me and for my patients specifically. Every man's got a fingerprint, I'll tell you. So you can't just crush stuff down someone's throat. Some men, testosterone replacement absolutely is dangerous for them. Let me tell you why. Because of the receptors that are in the endothelial tissue, in the myocardial tissue, in their liver for their myocytes, in the way it relates to their lipid, their profile. So when you give testosterone to men, let's just say most men, their HDL is not going to go up unless they inherently lose weight.
That's the good cholesterol, right?
Yeah, and that's bad. Now, so look at it. Let's do a list. Testosterone replacement, not even giving super physiologic, not gel versus pellets versus injection. This is all I do, right? So just giving testosterone to a man, and you look in the future what's going to happen to him, his labs, his vital signs. HDL will go down. Now, wait a minute. That's dangerous. Let's keep moving. It's dangerous.
Okay. Yeah.
That's an independent risk framing. That's an independent, I said Framingham risk factor. It's part of Framingham. This is evident. This show is for real doctors. Everything I do has to be vetted in my brain before I comes from the ear to the mouth, which sometimes it slips. Is for real physicians, and that's why they call me, because I'm in your face, but everything I'm doing has to be, number one, evidence-based. And then after the evidence-based, I do anecdotal medicine, and I do medicine from, see the stomach? Well, I'll show you the abs in a minute, because then the next thing is I do it from my gut, and it's don't hurt someone. If you give testosterone to a man, I could predict, I've been doing this for 20 years, essentially, for men clinically. So as a physician with a license since 2001, okay, if you give a man testosterone, you're going to, and you predict what's going to happen. Top 10 things, HDL is going to go down. Depending on the man and his diet and his genes and what he's doing, his LDL could go down. That's good. Blood pressure. Now, blood pressure. So 3 things kill people. Hypertension, diabetes, cholesterol. And the cholesterol is an abnormality. It's called dyslipidemia, which is too much of the bad, too little of the good. Forget triglycerides and apolipoprotein B, LP(a). I'm an expert, obviously. I'm a lover of lipidology. So forget that. Just inherently the general panel. So you take testosterone. What happens? Hypertension. Now, with me, none of these guys get hypertension. This is what they pay for. Now, these are, in the end, my men, if they come off steroids, I obviously have to use fertility medicines, the SARMs, the SERMs, the anti-estrogens carefully, and HCG, and then I transition to testosterone. We could talk about that.
Yeah.
But what do I watch, and why am I different from the anti-aging guys? Which I do put them down, because you don't want to anti-age, don't have a heart attack. Yeah. Testosterone has nothing to do with anti-aging. It's quality of life, because you're horny and you feel great.
Yeah.
But is it worth it you can have a heart attack. The data in 2013 and 15 came out, the Fed said in 2015, I believe it was, they said testosterone replacement we have to put a warning on it
I saw that.
because heart attack, stroke, and death. Really? That's been proven that they made a big mistake because the data was flawed. Now, it was the VA study. So you got a bunch of great veterans back from probably Korean War guys, Vietnam guys at that time. If you look at the age the epidemiological age bracket, and these guys are hypertensive, they're diabetic, they already have heart disease. And then they looked at the coronary arteries because they did CT angiography, and they gave these guys testosterone. Most of them actually went down because it was gel, because gel's garbage mainly.
Yeah.
And then they actually had more increase and uptick in heart attack, stroke, and death. Boom.
Yeah,
But that's horrible.
Yeah, and that's such a bad example, though. You know, like with testosterone, you have guys walking in. One of my big arguments is guys walking in and their testosterone's under 200. And they're not going to the gym. They're not eating right. They just don't want to do anything. So a lot of times what I've seen with the testosterone, it's been able to give them energy to do the things that can live a healthy lifestyle.
You know what Arnold said back in the day? This is a toy. Your body's a toy. These are toys in the gym. And so, and other expert doctors and people I know have said, it's really interesting with steroids. It's the drug that it makes you go to the gym.
Yeah.
So, but it's all about balance and obviously in keeping it right. But so when you give testosterone, your blood pressure will most likely get affected. But if it's balanced and you're not full of water and hypertensive and your kidneys are okay, you see, and you don't have heart disease already, or you do, or your left ventricle is enlarged. So if you have an expert physician that knows how to manage all those other things, you know, I tell guys there's cosmetic issues with testosterone replacement, then there's dangerous stuff. There's only two dangers, heart and prostate. And the prostate, there's no data.
Yeah. Can you jump into the prostate? Because I'm what I've seen in the research is, again, really back and forth. I thought I saw a study that showed that men who had higher testosterone, naturally, not induced, had less chance for prostate cancer. And I saw a study where they had prostate cancer. They did prostatectomy or radiation. And then they gave guys testosterone, and there was no increase for reoccurrence. But I don't know. I don't know if you've been seeing.
Here's the deal. I would just tell you the way I'd speak to a new patient.
Yeah, that's what I want to hear. I love this.
I give the evidence base. So let me just conclude from where we were before. So difference between testosterone and steroids is essentially dose and the types of testosterone derivatives. I mean, you're not going to do tren, although guys would like to for TRT. But I got some problems. I got a problem because I got guys doing tren, and then I have to reset their sexual desire. We'll talk about that's insane.
Yeah,
I got my tren video is blowing up because I'm begging men that, Doc, what do I do? Doc, I'm going to do a video next called Chasing Tren. What do I do? I can't get my sex drive back after I've done tren because you set the bar so high. Okay, so number one, testosterone versus steroids, dose dependent, and different types of agents. Because you take a little bit of testosterone, TRT, and then you take this much. See my hand going up to the ceiling?
Yeah.
So it's a dose dependent variable. And the next thing is testosterone. Is it dangerous? Is it not? You have to go like this. I have to go, I don't know.
You work with a good doctor and get blood work done and make sure they know what they're doing.